The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are gathered today for the next episode of TMD Demystified. I am Tony Urbanic. Today we are going to be talking about why do others want to make TMD complicated? Why do others want to make TMD complicated? So let's first talk about who are others. Well, others fall into many categories. Others will include a lot of people and doctors and services who attempt to treat TMD one way or another. And they would include, and we're going to go over these in some detail as I go through this, because the problem of why others want to make it complicated has a lot to do with why people, doctors, can't actually see the simplicity of this problem because they want to make it complicated. And those folks would include dental schools, TMD gurus, as I call them, independent training facilities, occlusal reconstructive programs, of which I can name a few, not to denigrate them at all. There's certainly good reasons to reconstruct the occlusion, full dental reconstruction, but treating TMD is not usually one of them. Orthodontist, oromaxillofacial surgeons, a physical therapist, and even some general dentist. Generally speaking, here's the problem. If the only tool you have, if all you own is a hammer, everything looks like a nail. And it limits your outlook. It limits your viewpoint as to really what's going on. So, there are reasons why people, individuals, and services want to make this complicated. And what's the definition of complicated? Many steps, a whole lot of steps, a whole lot of people involved, a whole lot of different kinds of services involved, many different kinds of x-rays, many different kinds of monitors and machines, including a stethoscope. It always amazed me, even while I was focused on treating temporomandibular joint, limiting my service to the surgical aspects of this. It always amazed me where I read articles or I listened to providers of one kind or another who used a stethoscope to document and to verify the different kinds of noises coming from the temporomandibular joint and trying to put some kind of significance on each one of the noises, a different noise. Each noise meant something else within the joint. I got news for you. The noise, they vary all over the place, from click to pop to grate to grind to squeak. Heard a lot of squeaks. And you can't categorize them on anything. And they change from time to time. One day it'll be a crunch and one day it'll be a pop. And who knows, the next morning it might squeak. Meaningless, but the number of articles that I've read trying to quantify and qualify each of the noises and make it really complicated is amazing. So let's kind of deep down into this. And again, I have to say honestly that I'm not trying to criticize, denigrate any particular service, doctor, school. All I'm trying to do is to bring it to your attention, the listeners to these podcasts who look at TMD in a much more simplified viewpoint based on what's really the cause of all the symptoms, which is inflammation. That's where this went off the rails a long time ago, where you went looking at the symptoms and you looked at the symptoms as more important than the cause, and the cause is inflammation within the temporomandibular joint. We've talked about that so much. But let's start with number one, the dental schools. Dental schools, certainly their mission is to teach young, soon-to-be dentists all about the science and the art of dentistry. But dental schools fall in the same category that most dentists believe, and that is really nothing can be done about TMD, and that the mechanisms that they teach start out with that the temporomandibular joint itself is a very complicated joint. Remember, I mean, the whole thing is about why others think this is complicated. And it starts out in the dental school by teaching the young soon-to-be dentists that the temporomandibular joint anatomically is complicated, physiologically it's complicated. I have had this particular conversation with hundreds of my colleague dentists as to what they were taught in dental school, and not one of them disagreed that they were basically taught in dental school that the temporomandibular joint and everything having to do with the temporomandibular joint and temporomandibular joint disorder or disease is very, very, very complicated. So the doctors start out from the beginning thinking that it's complicated. And so they got plenty to do learning how to treat teeth, periodontal disease, and remove teeth, and they will not be too interested in doing something that is complicated and unknown and makes their life more difficult. And that is one of the reasons why the overall treatment of temporomandibular joint has fallen by the wayside, and it took so long to actually look at what the actual cause is. Now, let me just comment as an aside. The actual cause is inflammation, and by itself, inflammation is a complicated set of circumstances. It is a complicated situation. We know a lot about inflammation over the past 50 years. We've done a lot of science, a lot of studies, a lot of great things have come to pass over what inflammation is, how it works, the effects on all the symptoms within the body. I've talked on this extensively. I can only recommend to the reader that he Google inflammation and begin learning, if he wishes, all the nuances and what is known factually about inflammation, and he will soon learn that there is equal amount that is still unknown about inflammation. And I've said many times on these episodes, I believe, and this is now a personal opinion, and my opinion can be wrong, and I try to differentiate between my opinion and facts in my discussions. But my opinion is, when we fully understand inflammation, we will have solved, at that point, we will have solved cancer. In any case, there's a lot to learn about inflammation that is not known at this time. So from the standpoint of inflammation, yes, there's a lot unknown. And regarding dental schools, that should not be left to the doctors in the clinics to teach. That should be left to the doctors in the basic science to teach about inflammation as best they can, and then apply that inflammation to the different segments and the different diseases that the dentist will usually address, which can include pulpitis and periodontal disease, and should include temporomandibular joint, the one joint that dentistry has been left to take the responsibility for. And it didn't really want that responsibility, but it was given that responsibility by the medical establishment. So it fell into the lap of dentistry, and dentistry took off in a totally different direction, focusing on the symptoms and making the treatment of the symptoms extremely complicated. So the dental schools have a lot of responsibility in this problem of making it complicated. And why do others want to make it complicated? Because they have not taken the responsibility. And again, not to sound overly critical or denigrating, but I am well aware, and you probably may also be too, but there are some dental schools that take this problem of TMD and spread it around as much as they can within the university, within the parameters of their care, and bring everybody under the sun, moon, and stars into the evaluation and treatment of this problem, when it doesn't need to be treated by multiple entities to get the story straight and to get the successfully treated. And the other entities that they bring into it, and I think it's mainly for the support of the university, not as an academic asset, not as an actual benefit to treating the disease, but it's spreading around and making the problem most complicated to bring many other individuals into it that then can be used to charge for the system. And that would include psychologists, psychiatrists, physical therapists, radiologists, MRI, CT scans. I mean, as an aside, to properly diagnose temporomandibular joint, you do not need an MRI or a CT scan. I mean, it's nice to look at. I mean, if you want to do a study of one variety or another of temporomandibular joint meniscus and position and things like that, or how much the joint is degenerated, or you're studying actually degeneration of bone of the condyle, to have those studies is important and needful, but to actually treat a day-to-day patient, and then you do not need that kind of radiologic help. You don't need an MRI, CT scan. A plain old Panorex is more than enough to actually see whether you have bone degeneration or not. And if you see bone degeneration on a Panorex, it's very clear that the problem has been going on for many years. I tell patients all the time, we're not treating an X-ray. We're not trying to make your X-ray look good. We're trying to decrease the symptoms. And if you can decrease the symptoms of temporomandibular joint problems, you've won the war. You've won the war. You do not need to change how an X-ray looks to be successful treating TMD. You just need to get rid of the symptoms. Again, this is totally misunderstood by some people in dental schools, and they spread it around to as many people as they possibly can to enhance the charges for the benefit of the school. It certainly looks good. It looks like, there's a TMJ Institute. I will leave the school unnamed, but they just started a TMJ Institute and listed all of the participants throughout the university to participate in their institute. A general dentist with simple tools and full understanding of the problem and just a modicum of understanding of inflammation can adequately and very successfully treat TMD. So it does not have to be complicated, but others certainly want to make it complicated. Next on my list is the TMD gurus. Now, every metropolitan area has one or two, what I call, and I say this honestly, go ahead and criticize me for it, I'll take it, TMD gurus who do their very best to make this problem complicated. Why do they want to make it complicated? Because the more complicated it is, the more steps they use to treat it, the more that they can charge. That's a fact. So some of these TMD gurus use all kinds of different modalities and machines and monitors, major occlusal reconstruction, orthodontic reconstruction, and it's totally unnecessary. But they do it in a way, and they teach it in a way, they literally teach it in a way where they can game the medical insurance companies, which kind of brings me to a point which I do not have enough time to discuss, is why medical insurance companies don't want anything to do with TMD, because they know it's a black hole with no end to it. And they have their own purposes. And I think that in the near future, I'm going to be discussing the insurance purposes regarding temporomandibular joint disorder. I have a lot to say about that, but I don't want to get sidetracked. So the TMD gurus use pretty much smoke and mirrors and anything they can think of that they can use to game medical insurance companies to provide coverage for the service. And I stick by that. And any of my colleagues who consider themselves TMD gurus, I'm welcome to take your call. I'm welcome to discuss it truly on a collegial basis. I have the facts. I have the studies. I don't like to see patients abused. And actually, I don't even like to see insurance companies abused. I don't like to see anybody abused. I like to see factual treatment. I like to see factual science. I use factual treatment. I use factual science, and don't want anyone, any entity, to be abused. And I think that we'd all get along a lot better if we stuck to that concept. And then there are independent training facilities. I mean, the first one that comes to mind is LVI, and they have a program that focuses on treatment of temporomandibular joint problems. But again, they make it as complicated as they possibly can. Their purpose, everyone has a purpose and a goal for their individual practice or their business or their training program or their school. And, their goal is to enlist as many providers in their training program as they possibly can. And by my observation, they try to make it complicated rather than simple. Again, they don't address the cause, they address all the symptoms. And then along the same lines, there are occlusal reconstructive programs that are specifically geared toward occlusal reconstruction, because the theory behind it is that if you can get the teeth to fit together exactly right, it's going to fix temporomandibular joint disorder. It's going to fix the inflammation within the temporomandibular joint, which is totally not true. If you have a perfect occlusion, all 32 teeth hitting normally in a centric occlusion position, no difference between centric occlusion, centric relation, you can still have inflammation within the joint due to acute trauma, due to chronic bruxism, and you will not alleviate the temporomandibular joint symptoms. You will not alleviate the temporomandibular joint disease. There are dozens of these training programs. The better known are Spears and Dawson. Kudos to these doctors. They've done tremendous work on working out the details of occlusal reconstruction. The point is, does that occlusal reconstruction treat temporomandibular joint disorder? No, it doesn't. It won't. If you do it for other reasons, I'm fully behind you. I'm fully acknowledge it's a valuable treatment. valuable. Then we come to the specialist, and I include my own specialist in there. Number one on the list, oral and maxillofacial surgery. I include in that orthodontics. Again, back to the point, if all that you own is a hammer, everything looks like a nail. And going back historically, I've talked about this before, but historically, back in the early 70s, when I started my training program, the symptoms of TMD have always been there. And because of our training programs getting very sophisticated in orthognathic treatment and treatment of the skeleton of the face, the temporomandibular joint itself came under the auspices and the view and the review of oral and maxillofacial surgeons who felt, well, this must be a surgical problem. And if we can get we can get the anatomical parts of the joint fitting together correctly, like we did with orthognathic surgery. If you have a skeleton that is anomalous, we had the ability beginning in the early 70s to cut apart the skeleton, put it all back together, and everything looks normal and acts normal and functions normally. So we assumed that same method would work with the temporomandibular joint. And for the next 20 to 30 years, we tried everything we could. Good doctors, good studies, not really good science, to change and maneuver and remove and modulate the meniscus and the position of the condyle and all kinds of things to alleviate the symptoms of temporomandibular joint disease. But for the most part, it was all unsuccessful. All that's left now in 2023, really of any value at all, is the total joint reconstruction, which should only be used when you have total joint damage. I mean, total joint loss is when a total joint reconstruction should be placed. And what I am seeing constantly is an increasing volume of total joints reconstruction being used on joints that actually do not need them. A simple non-surgical intraoral device and a proper protocol will replace hundreds, if not thousands, of total joint replacements. And that is an abuse of the system. It's an abuse of the patients. It's an abuse of everything and everybody. And this is my own specialty and my own colleagues. And for the first 36 years, I really did my very best to try to use that modality. And in the end, I decided this is not successful enough. This is going nowhere. And along those lines, you can hardly find an oral and maxillofacial surgeon anymore who wants anything to do with temporomandibular joint problems. And if they do, they need to at least try out a non-surgical device that actually works. Orthodontics in the same boat. Around here in Middle Tennessee, there's a plethora of orthodontists who tell patients who come in with headaches, earaches, jaw pain, things, that if they get their teeth fixed, if they get their occlusion fixed, it's going to make their temporomandibular joint symptoms go away. I really can't fathom at this point why they would be doing that other than to feather their own nest. It doesn't make any technical sense, academic sense, clinical sense, when you understand that the cause is inflammation within the temporomandibular joint. There's a few others, actually one other I just want to pick on. And again, I don't try to pick on anybody. If I pick on anybody, I really picked on my own experience and as an oral and maxillofacial surgeon. Physical therapists, again, they have patients and they're kind of boxed in because, our physician colleagues, if it's a problem with a joint, then as far as they're concerned, it goes to the physical therapist. And I see we have just so many case histories of physicians finding out or thinking that this is a TMJ problem that they're looking at. And they'll do one of two things. They'll either say, go see your dentist, or they'll send it to the physical therapist. And the physical therapist tries to address it like they address the physical therapy problems after joint surgery of the hip, of the elbow, of the knee, and they try to apply that same physical therapy mechanisms to the temporomandibular joint, and it doesn't really apply. The latest and greatest that the physical therapists have been doing, and it is not new, is dry needling into the muscles that get tight. I have no axe to grind about dry needling, but basically you're just treating a symptom. And if you don't understand dry needling, you can Google it up. But the theory is that you put enough dry needles into a muscle and it makes the muscle relax. So if you have shoulder pain, neck pain, you dry needle the trapezius, and the muscle will eventually give in and relax. And for a short time, that muscle will not be tight and it won't pull on the bone. It's at its origin and insertion where the pain originates from. The muscle doesn't hurt. The muscle hurts where it pulls on the bone, and that's where people complain of pain right across the back here, over the sternocleidomastoid at the mastoid process. But dry needling is not effective, at least long-term, very short-term. I mean, just a few days. But they want to make it complicated. And there are certainly complications, major complications can occur and have occurred with dry needling. And then you get into complicated drugs. We already talked about Botox. Why do you want to make it so complicated? Because medications can be very lucrative. And that falls then into the physicians who, unless you're a surgeon and can provide surgical services, your only hammer is a pill. And so whatever you see looks like service. If you only got pills, then that's what you'll give. Muscle relaxants, neuroleptics, non-inflammatories, of course, non-steroidals you can buy over the counter, but steroids, I've recently seen a lot of people on steroids, and a lot of people having secondary complications from steroids, making it complicated complications from drugs. And of course, the greatest complication from drugs, and I've seen plenty of those that have been put on opioids and been addicted because of their temporomandibular joint symptoms. So why do others want to make TMD complicated? Generally speaking, I have to say, after listening to myself drone on for the past 25 minutes, it's to feather their own nest rather than for altruistic purposes. I'll repeat that. It's for purposes to feather their own nest rather than true altruism. I'll let you think about that. I think you should. If you're listening to me this far, and if you think this is important, and if you're an honest person, and you're really trying to do what's right for yourself, your practice, your patients, I need you to review what I've talked about here today. We can document, I can document what we do with the Urbanic device and protocol. We have documented it well with an independent university study based on 3,000 successfully treated patients. I know that sounds self-aggrandizing. It does. It really does. I'm surprised, that we've accumulated so many successful patients, which now, that study is now a couple of years old, which now is excess of 4,000 successfully treated patients. But we're getting an increasing number of doctors out there who are less and less skeptical, are willing to join our network of providers who use this device and protocol in treating their patients, which is quite simple. You don't need complicated x-rays. A Panorex would do. And you get the Panorex just to make sure you don't miss something significant, like a sinus full of gunk or a tumor or a mass or a fracture. So, it doesn't have to be complicated. It is quite simple. When you understand the cause, you understand the problem and the science behind the cause and the problem, not the made up stuff, not the smoke and mirrors. If you'd like to criticize, I can be reached at tony@tmjservices.net, along with any comments, especially if you'd like me to discuss any aspect of temporomandibular joint disorder, disease. If you give me a topic, I will jump on it because I want to provide the topics that you want to hear about. My director of education and marketing is Naomi, and Dr. Naomi Williams can be reached at Naomi@tmjservices.net. Our website is a wide variety and plethora of information that discusses everything that we can quickly tell you about the Urbanic device and protocol, and that is www.urbanictmj.com. So until next time, I'd like you to think about this particular episode. Think about it carefully. And see if it doesn't make sense to you. See if I don't kind of hit the bell correctly, that the light bulb goes off, that you think about this a little bit. Until next time, until next episode, I am Tony Urbanic, and this is TMD Demystified.